We now come to examination of the cranial nerves. And you probably noticed throughout most of this videotape, we've actually covered as an actual process of events most of the cranial nerves. We've covered the oculomotor nerves, for example, when we tested pupil response. We've also tested the abducens and the trochlea when we tested extraocular movements. And we've also tested the optic nerve when we looked at visual acuity and also peripheral vision. Might just add that there's really no necessity to test cranial nerves in every client. But when a client has undergone some sort of a neurological change, such as loss of consciousness, muscle weakness, sensory changes, or headache, it's quite useful to go the whole step and carry out a comprehensive cranial nerve assessment. So the first step is to cover those nerves that we've not covered in other parts of this head, neck and cranial nerve examination. And of course the first cranial nerve is the olfactory nerve. Janelle, I wonder if you'd just like to close your eyes for me. And first of all, at the moment, do you have any nasal obstruction on either side? In fact, just block one nostril and just breathe through it. No problems there?
No.
And just the other side. Okay. And it's also very useful to check to make certain that the client doesn't have a blocked nostril, which will of course affect the function of the olfactory nerve. So just with your eyes closed and just blocking one nostril at a time, I want you to tell me what you smell as I put this to your nostril.
It's coffee.
Coffee, excellent. Okay, now if you can just keep your eyes closed and just block the other nostril. And tell me what you smell now.
Vanilla.
Excellent. So Janelle has normal functioning olfactory nerve and also smell sense in the brain. The next cranial nerve that we need to examine is the trigeminal nerve. And the trigeminal nerve has both a sensory and a motor function. The motor function supplies the muscles of mastication, and we can assess this cranial nerve by asking Janelle to close her mouth as tight as she can, and while she's doing that we can palpate the temporalis muscle on both sides and also the masseter muscle on both sides. Janelle, can you just grit your teeth as tight as you can for me? Just bite down. And we can feel very strong temporalis muscle acting bilaterally, and also the masseter muscle, which is also quite strong and equal. The sensory divisions of the trigeminal nerve concern really surfaces of the cheeks and the face. And we can test this first of all using pain receptors. If there's a problem with pain receptors, we can also test using temperature. So Janelle, if you'd just like to close your eyes for me, just relax. I'm not going to prick you, but I want you just to tell me whether you feel sharp or dull. And I recommend that you alternate using the sharp end of the pin and the dull end of the pin and ask the patient to see if they can differentiate between the two. So Janelle, I want you just to tell me sharp, dull when you feel something. All right?
Mm-hmm. Dull, sharp, 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 dull, dull, sharp, sharp, dull.
Excellent. And just do the same process for both sides. I do recommend you dispose of the pin just in case there has been an intrusion into the patient's skin and therefore the pin is contaminated. So I recommend we use a fresh pin and a sterile pin with each testing procedure. The other component of the trigeminal nerve concerns the corneal reflex. And this involves using a piece of cotton wool. Just ask the patient to look straight ahead, and this really produces a blink reflex, and it's a process of just gently using a piece of cotton wool just on the patient's cornea, looking for a blink reflex. And again on the other side. Excellent. No problems. And that's the trigeminal nerve. As I've mentioned, we've already tested the ocular motor, the abducens and the trochlea in relation to extraocular movements. The other muscle, or at least cranial nerve, that we need to test is the facial. And the facial concerns the muscles of facial expression. So we ask Janelle to go through a series of steps demonstrating use of these facial muscles. First of all, Janelle, can you just raise your eyebrows for me as high as you can? Okay, now frown. And we're looking for symmetry so that her facial muscles are moving bilaterally, symmetrically. Now I'd like you to screw your eyes up as tight as you can, and I'm just going to see if I can open them, and they're equal on both sides. That's excellent. Now can you show your teeth? Good. Smile. Very good. Now I just want you to blow your cheeks out. Excellent. Okay. And we can see that Janelle's facial muscles are working symmetrically, and she's able to show symmetrical facial expression. We've already tested the hypoglossal nerve when we had a look at the mouth and the pharynx. Janelle was able to poke her tongue out equally and symmetrically, and the only other cranial nerve we need to test is the spinal accessory, or the 11th cranial nerve. And this really concerns functions of the sternomastoid muscle and the trapezius muscle. And we can just ask Janelle to shrug her shoulders while we palpate and test the strength as she shrugs her shoulders. Try and resist. Shrug them as high as you can. Excellent. Okay, that's very good. Just relax. And that really ends examination of the head, neck and cranial nerves. As I mentioned at the beginning, it's a pretty busy series, and it does require a lot of practice. There are many areas here using the ophthalmoscope, the iriscope, the otoscope, testing cranial nerves that traditionally nurses haven't been involved in. So I do recommend that you stop the videotape at each section, you practice and read, and essentially practice using the equipment in order to be able to recognise the normal before you even consider looking for abnormalities in this area.